Hello and welcome to a special online edition of CBC News. We're bringing you the latest on how COVID-19 is affecting Nova Scotia.
Today, the province announced 2 new presumptive cases, bringing the total to 14. We learned today that 1 person is in hospital and one of the cases is connected to Dalhousie University.
The health authority is warning people about 2 potential exposure sites in relation to a high school basketball tournament between Thursday, March the 5th and Saturday, March the 7th. They say there is a low risk of exposure of anyone who was at the gymnasium at the Halifax Grammar School and the gym at the Hamburg Athletic Centre at St. Mary's University on those dates. Anyone who is at a high risk of exposure has already been notified.
And there are new measures to try to protect the province's most vulnerable. That includes $1 million for Feed Nova Scotia and $2.2 million for people on income assistance. Each person on assistance will receive an additional $50 as early as tomorrow.
Now, Michael Gorman has been our reporter working on this story. He's joining us from the CBC Halifax newsroom with the latest on all of this. Michael.
Tom, along with the measures that Amy just mentioned, the other big announcement from the government today concerns renters. Premier Stephen McNeil said today that anyone whose finances are affected by COVID-19 cannot be evicted. Now, these measures announced today focus on the province's most vulnerable population, but it's not the end of the announcements that come from this government, and Premier Stephen McNeil said there would be more news in the coming days.
Well, as you know, yesterday the national government announced a major package that is supporting workers across the country, waiving the waiting period for unemployment insurance and other benefits. We're assessing that, and we will be making some announcements about programs that we as a province can do to help support that.
Now, those announcements are also expected to target small businesses and people who are self-employed. The other thing that we learned today at the briefing, as Amy mentioned, there is 1 person who has been hospitalized as a result of COVID-19. But Dr. Robert Strang, the province's chief medical officer of health, said that person is now recovering in hospital. They called 911 and Dr. Strang said the system worked as it should. The patient was brought to the Halifax Infirmary, admitted to the COVID unit there, and everything followed the protocol that health professionals hope that it does. Tom?
All right, Michael, thanks very much for the latest on all of that. Michael Gorman in our newsroom.
One of the biggest employers in Nova Scotia has closed much of its work for the next 3 weeks. The Halifax shipyard told employees today it will suspend its work due to COVID-19. The company says 1,100 of its 1,800 staff will be sent home. The firm says that the others will continue to work where it is possible to maintain safe distances. It promises to pay people sent home for tomorrow and next week. The company says it may shorten or lengthen the shutdown depending on what happens in the days ahead. 2 sister operations, Marine Fabricators and Woodside Industries, are also closing. Dalhousie, the region's largest university, has announced some drastic changes to how it plans to operate in the coming months. All spring and summer courses will shift to remote or distance teaching. That means no on-campus classes until the fall. The university is also ordering all students to leave campus accommodations in both Halifax and Truro by Friday, except for those who have nowhere else to live. Dal remains open, but many buildings have visiting restrictions.
The province is hoping retired doctors and nurses will step out of retirement to help the medical system cope with a potential wave of patients during this pandemic. Janet Hazelton is the president of the Nova Scotia Nurses Union. First of all, Ms. Hazelton, how much interest is there among retired nurses for this idea?
There's an incredible amount of interest. I've been getting emails from nurses that have retired as recently as last year to some that have gone back 2 to 3 years, offering their support during this pandemic.
Would they necessarily be asked to deal with COVID-19 cases, do you think?
I think it's going to be an individual decision, for the nurse and for the health authority, on where they're going to utilize these retired nurses, because each of them will have a unique skill set. And depending on their skill set and when they retired, decisions will be made around what they can do or cannot do. For example, if they've retired several years ago, they'd still be able to help us provide personal care with maybe long-term care residents or, phone interviews, those kinds of things that are taxing our system right now. Telephone calls within our healthcare facilities are just at an all-time high. People are concerned about their loved ones that are in our facilities, and they're not able to go visit or go see them. So we've got an increasing amount of telephone communications that are happening within our facilities. So someone that was recently retired could check on a patient and call family members back to reassure them that they're getting the care that they need and that they're fine.
Would there need to be some retraining required here?
Depending on what they're being asked to do, yes, there would be. But these new swabs, the testing for this virus, is new to us all. So our nurses that are currently doing the testing have gone through some education on how to do it properly. And so those nurses today are getting the education, and the retired nurses would get the same type of education.
Do you have any idea how many might be ready to go back and help?
No, the College of Registered Nurses is looking after, no, sorry, the College of Nurses is looking after the people, the nurses that have called them, whether they're LPNs, RNs, NPs, they're maintaining the list, and they will be sharing that with the Department of Health, who intend to control it based on the needs out there in the community, whether it's long-term care in the community or in our healthcare authority. Within our healthcare authority.
If they are asking retirees to go back to work, could you in fact be putting vulnerable people at risk?
Well, I think that's a decision that these nurses are going to make for themselves, and depending on where they're asked to work, those will be personal decisions that, quite frankly, everyone is having to make today. You know, there's a lot of nurses that are pregnant that are very concerned. I have lots of nurses that have respiratory COPD, and they're compromised, and they're concerned. So I think efforts are going to be made to try and alleviate, to get rid of that fear amongst our nurses, and hopefully those that have legitimate reasons to be concerned, they could be reassigned to other places. Because let's be clear, we have a lot of needs within our healthcare system other than this virus. So we still have a huge need for nurses in long-term care, and in hospital, patients receiving chemo, people having emergency surgeries. So there's a huge requirement for nurses other than caring for people with this virus.
All right, Janet Hazelton, we appreciate your thoughts on this today. Thank you very much.
Thanks, and have a great evening.
Gyms, yoga studios, and spin clubs have all been shuttered. For thousands of Nova Scotians who are members, they need to figure out their fitness schedule at a time when many health experts say exercise is crucial. So many fitness clubs are moving to online classes, and one gym in Halifax, Evolve Fitness, is doing that along with helping others in the community. Colleen Jones has more.
I'm at the door of the empty Evolve gym, except for trainers Alan Dalton and Emily Herman and co-owner Mitch Bemvey. They're setting up for another virtual class. For people who are gym junkies, what will virtual be like? I'm taking part outside in their parking lot.
Yeah, keep on looking slightly in front of you.
In front, okay.
He knew I was doing it wrong.
You know, staying in shape is incredibly important for so many health reasons. Anxiety and stress are two big things that a lot of people are going through right now, us included.
But this is a class and an idea with a twist. They're asking for a minimum $5 donation from people who do the virtual workout. In just 3 days, they've raised $19,000. All of it goes to buy gift cards from local businesses who are hurting.
100% of the money is going to gift cards for local businesses, and then the gift cards can then be used as prizes because it's a 21-day accountability challenge. So we're going to have little mini challenges, keep people accountable, posting as much as they possibly can.
Even people who aren't clients, we've had so many people just in Halifax in general reaching out, so it's amazing to see how many people really want to help support local businesses. So I'm super proud that we're doing that.
But that's not all. They've offered their weights to members to help them in their workouts, so people are coming to grab a dumbbell or two. And that's where I find Brian Strecco.
I'm bringing these weights over to our son, Stefan. Yeah. And he's got cystic fibrosis, and he's in a self-imposed quarantine for as long as it takes now.
Wow.
Yeah, he could be
How
off.
will the weights help him?
Well, he's an avid guy, works out to keep up his health.
This is a gym that's going the extra mile to try to keep their members active and socially engaged to help other businesses in Nova Scotia hurting from the coronavirus pandemic.
I know it gets tough. It gets tough.
He can't hear
He's watching me.
Colleen Jones, CBC News, Halifax.
Well, several companies and utilities are promising leniency when it comes to you paying your bills. Nova Scotia Power says it will not disconnect customers who are in arrears during the COVID-19 outbreak. Halifax Water says it is willing to discuss payment options for those who can't afford their bills for the next 30 days. And some home heating companies are offering to forego interest charges on overdue furnace oil bills. Halifax Regional Municipality is also looking at alternative payment options related to property taxes due at the end of next month.
While many businesses in Nova Scotia are closing, taxi companies are remaining open. Two companies in particular are doing what they can to help out during the COVID-19 pandemic. Brent Kellaway reports.
District 11 Taxi and Delivery is offering free deliveries to anyone who is self-isolating in the New Waterford area. They will also be offering free drives to and from the grocery stores and pharmacies. Elizabeth Doyle is one of the company's owners. Her mother recently passed away, and it made her think about what she would have been doing if her mother was still alive.
I mean, it's definitely something that I wouldn't want her to be out in and putting herself in that vulnerable situation. And the population in New Waterford is largely seniors.
In Halifax, a limo company is taking extra precautions as they pick up snowbirds at the airport. Everyone who comes back into the country must go into self-isolation for 2 weeks when they return. Habib, the founder of Crystal Limo, says people are happy to still have the service.
They really appreciate and they understand the situation. And we need to serve him, take him home safe. This is the best we can do.
Both companies have added extra precautions for their own and their clients' sake.
We have a Lysol, we clean the cars, and every time client came and leave a car, we keep it clean. This is the best measure we can do. We ask the clients if they are okay in a gentle way, if they are healthy.
We hope if people are feeling sick that they'll use the free delivery, not the free taxi. We do sanitize our cars and everything like that. But we'll do the best we can do. It's going to be busy. But like I said, if someone is feeling sick, use the free delivery, not the free taxi.
District 11 Taxi and Delivery will offer their free services for as long as they are needed, starting tomorrow. Brent Kellaway, CBC News, River Ryan.
Many businesses have had to close because of COVID-19. Others are struggling with how to stay open and keep customers safe. I'm joined now by Jim Cormier with the Retail Council of Canada. So, Jim, I know the numbers are changing all the time, but can you give us a rough idea how many businesses in Nova Scotia have had to shut down because of the pandemic?
Well, it's hard to give exact numbers, but suffice it to say that the retail sector is still up and running for the most part. We've been involved with social distancing, and it's been the responsible thing to do. So, but for the most part, you can be assured as a Nova Scotian that should you wish to buy online or wish to go in store, yes, there will be a lot of restrictions, but for the most part, you can feel confident in knowing that you'll go into stores and you will be safe and secure. Retailers are taking extraordinary steps to keep everything clean and safe, but yet still provide a welcoming experience. So, it's still business as usual, despite what's happening in some of the neighboring provinces.
Now, we've seen some businesses adapt. You've got restaurants who had dine-in offering takeout, wine stores selling online only. Do you think we're going to see more of that sort of thing? And, what kind of challenges are there to shifting to that way of doing business?
Yeah, and again, I don't want to make it sound like everybody's up and running. It's just as far as, government mandates. Some retailers have made the decision to close their doors for X number of days or weeks, more about in concern for their employees and for their customers. And in some cases, they're selling a certain type of product that they feel there's not going to be much demand for given the current situation. So, it's still uncharted territories. Retailers are nothing if not adept at turning on a dime. And so some of them are moving more into their online offerings. Some don't have that luxury, especially smaller independent retailers. So, they're doing what they can. And we just encourage everybody to be patient, to understand that it's not business as usual, but retailers are still doing everything they can to provide customers with the opportunity to get the items that they want and need.
Now, many of the malls in this province remain open, but on reduced hours. Are you expecting that to change in the coming days?
Well, I don't want to speculate. I'll leave that to others. Fact is, we have a lot of retail members in our Retail Council of Canada that do business in malls, and so we've been keeping a close eye on it. We're in daily discussions with the Nova Scotia government and with the various municipal governments as well, just to try and make sure that we can keep everybody whole as long as possible, understanding full well that public health does come first. So when the time does come where decisions are made by those in authority, we'll do our best, but we'll take our lead from medical professionals.
All right. Well, Jim Cormier, thank you for your time. We appreciate it.
Look, and before I go, I encourage once again everybody, if they can, try to support the retailers in your local communities. They do so much for the larger community and employment. They pay taxes. They sponsor local sports teams. They're hurting right now, so do your best to support them if you can.
All right. Thanks again.
Thank you.
The Royal Nova Scotia International Tattoo has canceled this year's show because of the pandemic. Organizers announced this morning that the 2020 edition of the event will not go ahead. The tattoo brings in performers from around the world and usually takes place at the end of June and into the first week of July. This is the first time in 41 years the event will not take place. The executive says the international nature of the act made it impossible to organize, even if public events are back on by that time. Tickets that have already been purchased will be refunded over the next 2 to 3 weeks, and planners are now setting their sights on the 2021 tattoo.
And that is it for us for now. As always, you can find the latest on our website, cbc.ca/ns, or on the CBC News app.
Thanks for watching. We'll see you next time.